Hello. How is everybody? Are you in the open wide? You know what day it is. It's Talk to Me Tuesday. Hey everybody. Andrea Carolyn checking in live. We're having a good time. I think I have the next couple, like 6 days off work. I'm excited. Hopefully my boss doesn't see me because I stole a mask. Uh-oh. Uh-oh, I'm busted. Look at my fancy new headwear, everybody. All right. This is Talk to Me Tuesday. This is going to irritate my neck. Hold on. This is Talk to Me Tuesday Teeth Edition. All right. We're going to talk teeth tonight. I have a habit of seeing people lost and wandering in the toothpaste aisle, and I feel bad for them. I mean, that is a confusing aisle. There's seriously like 8 million toothpaste to pick from. I mean, how does somebody who doesn't know anything about teeth, how do they pick? I'm here to help. You guys, I like to provide value, okay? I know I've helped everybody learn how to get their glowing, happy skin like me, but I also think that there are some serious topics that maybe I should touch on every now and then, and I happen to be a oral health care specialist. 16 years as a hygienist. How cool is that? All right, let's see who's tuning in. Uncle Bruce, hoorah! You like my gear? I bet Uncle Bruce has one of these. Oh yeah, look. Oh yeah, that's to see in that dark cavernous cave. Now, a couple of people asked me questions. I put a little heads up that this Talk to Me Tuesday was going to be all about teeth. And a couple of people put some questions out for me to, get some answers to. Now, we're not going to spend butt time. What is that? Oh, look, Dina. Hiya. Okay, so a lot of the people that are commenting right here happen to be the ones that commented when I announced that this was going to be Talk to Me Tuesday Teeth Edition. So obviously, people are interested in how to have the best oral health that they can have, right? So if anybody in there, oh look, a fellow hygienist. Hi, Brittany. Hope you're doing great with that new baby. All right, you guys, as we're going, I can see the comments popping up below, like there's no technical difficulties. So if anybody has any questions that they want to include in this edition of Talk to Me Tuesday, hey, just shout them out below. We're going to cover, somebody asked a question on some advice on what to do if you haven't been to the dentist in a long time and you're feeling like totally scared and confused and there's a lot of things going on. And, a lot of people are afraid to come to the dentist. So we're going to talk about some things you can do to kind of get over that hump. And I'll give you some advice. What's sticking up off my head? Oh, my light. Another person asked a question about, hey, what are some teeth whitening options that are not going to hurt me? I have sensitive gums. Now that person is tuned in live, and I was wondering if that sensitive gum thing, like I personally have never had any gum sensitivity when I wipe my teeth. But after I wipe my teeth, like moving air past my teeth, oh my gosh, I felt like my teeth were going to catch on fire. They were so tender. But with time, as I've gotten older and with time, as I've whitened my teeth a few times, it has gotten less and less. But with time, and if you use the right products, anyway, so we'll touch base on that. And I can't remember the last question, but you guys, we can probably cover teeth once a month. Honestly, I do have a new passion. I do have something that I love to talk about now, and that is skincare. But my longtime passion for a really like almost 2 decades now has been teeth and taking care of people's teeth. And can you imagine getting your teeth cleaned by someone wacky and kooky like me? Can you imagine? People tell me it's like Ellen DeGeneres just cleaned their teeth and they had so much fun and they can't wait to come back. So if anyone out there is looking for a dentist that really is not judgy, no dentists are judgy, by the way, but if you're looking for one that you'll feel more relaxed and the people are kind of, down to earth people, give our office a try. And I will post a link below. Our office is running for best dentist in Gwinnett County. So bam, maybe I can post that link below. I appreciate your votes, everybody. And I'm trying to get Dr. Wynn to do the dentist dance off, but he said his knee is hurting. Dr. Wynn, if you're tuning in, you got to step up, man. Some of these dentists, they don't even dance as good as you, and they're out there going viral, okay? I may or may not have seen Dr. Wynn break dance before. All right, Afton Rummel, she's tuning in all the way from Panama City, no, Navarre Beach, Florida. All right, okay, so let's talk teeth, you guys. I don't see any questions popping up, but this is a really good piece of advice. Okay, let's say you haven't been to the dentist in a really long time and you feel like you're probably gonna get some bad news. And a lot of people tell me, I don't go to the dentist because I don't have insurance. Well, unfortunately, people feel that way, right? You are going to have to, I recommend you get some referrals from your friends. You know, who is their dentist that they trust? Maybe find people who have gone to the same dentist for years and years and years, and they just absolutely feel like they trust their dentist. And here's what I would do. I don't know if you guys have ever heard of bite wing x-rays, but they're a basic set of back teeth x-rays, usually 2 on each side. And that little set of x-rays and a comprehensive exam, you know, from there we can kind of go on and see what else you might need. But those little bits of information that are not very expensive, they can help your dental health provider point you in the right direction and see what's next, right? So don't be afraid. If you haven't been in a long time and you just, you know, if you have a specific area of discomfort, of course, you know, whoever you go to, they will address that first. But after that, you know, those simple little back teeth x-rays that they took, that can point them in the next direction. In our office, we typically treat whatever's bothering the patient first. And then, like, if we see a tooth with a huge cavity that looks like, hey, boy, this one has potential to become like a root canal, let's fix it while it's a $200 filling, rather than come back next year and you need a $2,000 root canal and crown and everything, right? So like I said, find a dentist's office, you know, usually somebody that your friends go to or a place your friend works at, and somewhere that you know, doesn't take advantage of people. I don't think anybody means to take advantage of people in the dental business, but I do think that it can feel that way. And if you don't have dental insurance, you know, you definitely want to go somewhere that you know they don't add on little extra things. And anyway, all right, so I don't want to badmouth any other dentist. Our office does not do that. All right, does anybody else have any questions below? This is the Talk to Me Tuesday Teeth Edition. Oh. Look, Afton comes all the way from the panhandle of the United States to come get her teeth cleaned by me. What? Miss No Cavities in the house? All right, that's why you like coming to the dentist, because we don't give you any bad news. All right, okay, so another topic that you guys asked me to cover was about teeth whitening. Okay, so teeth whitening, like somebody said, they tend to have sensitive gums. Well, there's a lot of different teeth whitenings. There's fast, instant teeth whitenings, like you may have seen at the dentist's office, where they're shining the light on your teeth. There's a lot less aggressive ways to do that particular procedure now. You have that. You have custom fit bleaching trays. That's probably like a slow, steady way to really good results, long-lasting white teeth. And then there's even awesome disposable options now, like Crest White Strips, or at our office, we sell the professional prescription strength gel on a strip. Yeah, 35 bucks. Get you 10 strips, and that should be enough to kind of get you dazzling white. Now, I happen to have a little piece of whitening, something that I picked up at the dental convention, so I'm going to show you guys how to use it, all right? And I'm going to give you some good news, too. All right, so a lot of people will say that their gums tend to be sensitive when they whiten their teeth. And I think that could be a lot of the product kind of gets on the gums, right? Instead of sticking on your teeth, you see how your gums have like a scalloped edge, right? So of course, something straight across your teeth is going to touch a little bit of your gums, right? So a lot of times, if you get one of those custom fit trays and you're applying the little dewdrops, little super small drop of bleach in each little reservoir for each tooth, just make sure you're not overfilling that. And when you put the little bleaching tray on your teeth, you know, it won't ooze out and the whitening agent won't get on your gums. Now, when you use something disposable, sometimes that's a little harder to get around. Hey, Alexis. I bet Alexis has helped a lot of people whiten their teeth, huh? She's also helped people get the best skin of their lives. What do you think about this mask, Alexis? This is what Dr. Wynn wears. Are you kidding me? I would feel like I was underwater in that mask. I happen to have a few at the house for when Jeremy cuts the grass. So I borrowed these from Dr. Wynn. I took 3 of them. I'll pay you back, Dr. Wynn. Anyway, all right, Alexis, thanks for tuning in. Thanks for tuning in. All right, I'm going to show you guys a really cool, this is a product called Opalescence Go. This is not a high-tech product by any means. Like, there are a ton of whitening options out there. You just need to talk to your dental care provider. But this one I like. Okay, you don't have to keep up with bleaching trays. Cost-wise, these are usually a little more cost-effective, but if you pay one time for bleaching trays, each time you want to whiten your teeth, like every 6 months, once a year, each time you want to do that, you just have to buy the gel, right? You have the device that puts the gel on your teeth. With these guys, because they're disposable, you have to buy new every time. So eventually you would buy enough of these, you know, that kind of adds up to the same price as if you would have just paid the maybe slightly higher fee for the custom fit trays. The only bad thing is you have to keep up with those trays. Like if your dog eats them, sorry. If you lose them, if you throw them in the trash, if you move and you put them in a box and you never find them again, that's what happened to me. That's when I switched over to this. No comment. No comment. I don't think she watches. Gosh, me and Alexis went to dental hygiene school together 16.5 years ago. Holy cow. All right, you know what? I'm going to show you these whitening strips in just a little while. But like I said, our office sells little disposable strips with a professional strength gel in there. You know what? This is hydrogen peroxide. There's carbamide peroxide, which is professional strength. But these hydrogen peroxide options, they will also get you where you want to be. Slow and steady whitening will last longer too. I believe if you take your time to get nice and bright, it'll take more time for that bright white, you know, shiny white teeth look to fade away. Now, if you do like the 1 hour whitening where you sit under the light, that's a real quick, your teeth are going to look as white as they've ever looked. That's almost like doing 2 weeks of this in one little 1 hour session, right? So that is like, looks really good. And then over the next week or two, it kind of fades down just a little bit. Hate to tell you that. You go home with bleaching trays usually to take it back up. All right, slow and steady wins the race with whitening. All right, we're gonna keep this pretty short and sweet. Maybe I could be on TV. Look, I'm not a doctor, but I play one on TV. Thanks, Cheryl. Thank you for tuning in. Here, let me put this back up. All right, you guys, this is the most important thing that I want to tell you about teeth, okay? Wait. The sensitivity thing. Let's say that your gums aren't sensitive. Let's say whitening your teeth makes your teeth sensitive. A lot of the new products, they know, like that is a common concern that people have. They're actually putting sensitivity type ingredients in the whitening trays, or some people will get a whitening tray and put like some Sensodyne toothpaste in there and sleep with that on their teeth maybe a couple nights, like really desensitize your teeth. And then go forth with your bleaching that might lead you to sensitivity. Oh yeah, you know what? I didn't say the name, but I will private message you. I don't want to be advertising any particular brand, even though I advertise these. All right, I'll private message you. The really good ones, I'll even see if I can like give some away as a prize one day. All right. Okay, here's what you guys need to know. The most important thing, plaque removal. Anybody out there confused when it comes to plaque versus tartar versus plaque? Okay, so plaque, if you lick around your teeth and they feel kind of fuzzy, that's plaque. If you floss your teeth and you feel your floss like get caught like something like kind of crusty, like a little lump, that's tartar. Plaque can usually be removed, right? You can usually remove plaque by yourself with floss. You can remove plaque all by yourself with floss or toothbrush. You know, I prefer an electric toothbrush because I believe it removes more plaque. But reducing the amount of plaque bacteria in your mouth, that is the name of the game, you guys. I don't know if you know it, but when you're at the dentist and you're having your teeth cleaned, and you say to the person cleaning your teeth, male or female, ow, you touched my gum. I got news for you. I got news for you. We are in your gums. There is a small space between your teeth and your gum. I promise I will have diagrams next time. There is a small space between your teeth and your gums called the sulcus. And a good way to explain this space is like when you eat popcorn and the little pieces of popcorn get wedged up in there. Yeah. Me, Alexis, all my teeth cleaning buddies, that's our playground. We go in your gums and we get the plaque and the tartar out of there. Now, some people, the plaque and the tartar has gotten deep enough in there and stayed in there long enough that they actually have an infection. And that's why it hurts when you get it out, right? So if you can, plaque sits around long enough, it hardens up and turns into tartar buildup. So if you can remove more plaque with your fancy toothbrush and your floss and whatnot, then there'll be less tartar buildup and there'll be less gum inflammation. So there you go. I gotta play that one again. Anyway, so plaque removal is the name of the game. Now I will name drop. I use a Sonicare electric toothbrush. I don't know if you can hear it. This thing buzzes like 10 million buzzes a second, right? So I push the on button and it runs for 2 minutes. This toothbrush is amazing. Now, the vibrations that it makes, they say it's like doing this with your regular toothbrush, 2 weeks worth of brushing your teeth like that in 2 minutes. When your toothbrush is doing all the vzz and vibrating and getting the job done, 2 weeks of brushing in 1 2-minute session. That's what they say, and I believe it. People who go to the dentist and have tons of plaque and tartar on their teeth, and then they go home and they pick up one of these electric toothbrushes, they come back looking a whole lot healthier, a whole lot fresher, you guys. So I strongly recommend that you use a toothbrush with some horsepower. Now the Oral-B brand, I'm not gonna pick which one I like well, I do like the Sonicare the best, but the Oral-B also is a superior plaque removing machine, all right? So think about this. Every time you brush your teeth, the bacteria, like 5 minutes after you brushed it away last time, it started to grow back. So this is like knocking down that layer, knocking down that high level of plaque that had all day to grow back, right? Well, guess what? In less than 5 minutes, it's going to start to accumulate again. And then that night, knock it down, right? It's like an anthill. Like if you never let the anthill get real big, you just keep kicking it down, you keep kicking it down. That's what prevents gum disease for most people. Now, there are some autoimmune situations and some people's gums decide like, hey, we're not going to have teeth anymore. And their gums go haywire, right? All right, so you have the physical removal of plaque and, of course, floss. Now, we'll cover that another time. But my favorite toothpaste, when I'm in the toothpaste aisle and someone tells me like, oh, I have bleeding gums or something, I like a toothpaste designed to help with inflammation or gingivitis or bleeding gums. Colgate Total is designed to kill germs for up to 12 hours after you have brushed your teeth with it. Like it leaves a little germ-killing film on your teeth so that anthill of bacteria can't build way back up. There are some really cool graphics that I can show you, and Colgate Total has done a lot of research to show that their toothpaste really helps prevent the bacteria from coming back. There's also one on the market now called Parodontax, and it's a whole different main ingredient. We don't want to get too scientific, but same thing. It just keeps the level of plaque, harmful plaque bacteria down. Now there's good plaque. This could get so confusing. There's good bacteria. There's bad bacteria. There's bacteria that causes cavities. There's bacteria that causes gum disease. Like, it is so confusing, you guys. So when you do have like a pretty knowledgeable oral health care provider, they will customize a treatment plan and a brushing regimen. Not everybody goes home with a sample of Colgate Total. I've got Sensodyne. I've got gosh, I can't think of it. I've got kids toothpaste. I've got Pronamel. I've got all kinds of, there's so many different ways that toothpaste can help different people that, you know, you just have to customize a plan. I have different ways to clean between the teeth, brushes, floss, water pick. Oh, I could go on and on. All right, you guys, I will fine tune a presentation for next time. Does anybody else? Oh, Brittany, a hygienist. Total Care. How about that? That's her favorite. Colgate all the way. Zach, I knew I liked you, buddy. Brittany Nichols loves the Sonicare. Yeah, I'm going to have to get a little more organized in my presentation. Yeah, there's so much we could talk about, you guys. I love talking teeth. I have a pretty good success rate. Like the people that come to my room and sit in my chair and come to me with gum disease, we get that stuff turned around. A lot of people, it takes time. Some people, it doesn't happen. But I would say I help motivate a lot of people to change their path that they're on with their oral health, right? Alexis, I know you do too. Brittany, I know you do too. All right, here, check this out. This is a hydrogen peroxide product. So that means that you could probably buy this online or at the grocery store, no problem. All right, we're going to open this up. I knew this would make me talk funny, so I'm saving it for the very last. All right, you guys. I want everybody to remove as much plaque as they can twice a day. Floss. I floss in my car on the way home from work. You can floss before you go to bed. Floss at least once every 24-hour period. I don't care what time you do it. If anybody out there wants to argue with that, all I care is you get that plaque out from between your teeth at least once a day. If you have places that catch food, do it as much as you want. All right, so here is a really cool product. This is a little plastic holder for this little bleaching agent in here. There's some bleach in here. This one's fun, you guys. I got a bunch of these free and I just never used them. They expired. Whatever. All right, so here's what we're gonna do. We're gonna bite on this thing. All right. Okay. Oh, real sexy, right? Okay. We're going to get some vacuum action. All right, watch this. Sucking on it. All right. And then I peel this little carrier tray away. And look, I got the white strip on my teeth. Tastes delicious, right? Most of the whitening agents have kind of a funny taste. They try to disguise it with some mint or some apricot or whatever. All right, so look at this. So you no longer see the little scallopy triangles between my teeth anymore. So this product definitely covers up my gum. If you have sensitivity on your gums, this might not be the best product for you. You might want to stick with a custom fit bleaching tray. Oh man. Oh, this reminds me of my bite guard. All right, you guys. Oh my gosh. This is kind of embarrassing actually. All right. This has been a huge hit. This is like so many comments and feedback. This is what Talk to Me Tuesday was supposed to be like when I first started it. Okay. Look, I'm amazing. I believe you're going to be amazing too. There's another hygienist over there. Clayton State, right? All the good ones came from Clayton State. Class president, 2001, 2002, baby. All right. Okay, you guys. So I showed you one of my favorite whitening products. If I just walked around with this on my teeth, I'd look fantastic. All right, you guys. I love you so much. Keep an eye on what I'm up to this week. You won't want to miss it. I'm going to go check out some dental hygiene facilities in another state. Wink, wink, hint, hint. All right, I love you guys. If anybody has any questions about teeth-related stuff, you know, shoot them at me. Let me know, and we'll address them on the next Talk to Me Tuesday. Tune in next Tuesday, and as always, I really appreciate you guys. You don't have to be a Hollywood star to have teeth like one, okay? You just got to come meet Dr. Wynn, right? Or a good dentist near you. All right, I love you guys. Dina, I'm going to message you. Bye.